When young children have experienced trauma, it affects their behavior and interactions in the classroom. How can early childhood teachers and caregivers respond to trauma-related behaviors in order to best support children's needs?
Schools are up against having to try and support the behaviors of children. And often they're trying to do it from a behavioral approach, which works when there's not trauma. But trauma doesn't respond well to a behavioral approach.
So I think some first steps that teachers or others can take to be more trauma responsive or trauma informed yourself. One is to really kind of dive into the research and knowledge that's out there about trauma, and so learning about the types of trauma, how it affects children, and then being able to share that information with families.
One of the really most useful things that adults can learn is just a tiny little bit about how the brain is organized. If you think about your brain as this upside down triangle, the top part is the cortex, the part where you think, the part where speech and language is. When you talk with a child and you're trying to reason with them, you're trying to get to their cortex. But what we know about the brain is that all information from you talking with them and interacting with them comes in low. It comes into the lowest part of the brain first, and then it goes to the middle part of the brain, and then it goes to the top part of the brain. So the truth is, if these systems down here are overactive and dysregulated, the best words in the world, the most sensible thing in the world, comes into this dysregulated part of the brain and it gets short-circuited. They literally do not even hear you. So if you want to get to the cortex, you've got to regulate these lower parts of the brain and connect with the child. And so we refer to this sequence of engagement. And the sequence is regulate, relate, and reason. Before you can reason with somebody, you've got to be connected to them, right? They've got to be receptive to what you're trying to say. And before you can meaningfully connect with them, they've got to be regulated to a certain degree. Now, they don't have to be perfectly regulated, but they have to be regulated enough to connect. Now, the other part of that that's really interesting is that because human beings are contagious, if you're dysregulated and frustrated and angry, you will never regulate a child. So the first step in that sequence is to regulate yourself first. Make sure that when you engage the child, you're not yelling, you're not threatening, you're not wagging your finger, that you're composed enough to be regulated when you engage them. And then introduce, suggest some kind of regulatory activity, get them regulated, connect with them, and then you can talk with them.
Sometimes we go for a walk. That physical exercise just gets them distracted, gets their body distracted, gets their arms distracted from like hitting other kids or hitting teachers. And then another way I might do it is in the form of a song. What's a better choice? Think about it, take a deep breath. And you use your voice. And a lot of times that'll help curb it as well. But I think the most powerful strategy is that you don't use any one strategy, is that you use a multiple approach and recognize that situations of different children are different.
One of the things that will happen with these kids that have trauma-related behavioral problems is that those behaviors will be disruptive to the class, they'll be upsetting to the teacher, and so the teacher wants to stop it.
Sometimes as caregivers, and it's very understanding, there can be a tendency to sort of want to shut that behavior down and say, I'm not going to tolerate that or whatever, rather than really saying, this child is saying, I need you, I feel unsafe, I'm scared.
The interesting and important thing is that your understanding of why they're doing the behavior is going to be related to what you think will stop the behavior. So if you think the behavior is motivated because they're trying to avoid work, or they're lazy, or they're naughty, you're going to say, all right, here's the reward if you do good things, and here's the consequence if you do bad things. And oddly enough, when you try to apply that, that usually blows up in your face. Actually, studies show that when you take kids that have trauma-related behavioral problems and you use conventional behavioral paradigms, you actually increase the rates of critical incidents, elopements, aggressive behaviors, restraints. And so then that leaves you with this sort of this dilemma. Well, then if you can't use like conventional points and level things, what do I do?
What we have to do is remember that that child is asking for our help. And really what they're saying is that I feel unsafe and I feel insecure. So what we need to do is start using the language of safety, letting them know, I'm going to stay right here with you until you're calm.
And this is where you have to learn a little bit about and get comfortable with what we would refer to sort of as relationally based interventions. Listen, why don't you and I go for a little walk? And you begin to learn how to compassionately engage the child and introduce regulatory activities.
We've got to go back to offering that child a sense of safety and security and letting them know it's okay. I understand that this is really hard for you. So I will be here. We're going to wait until you're calm, and then we're going to start again.
And one of the best ways to do this is not to be face-to-face, but to be parallel. And to be parallel while you're doing some kind of patterned, repetitive somatosensory thing. Walking, playing cards, coloring, in parallel. And if you do that in parallel, pretty soon the child will start talking. And you'll have created a regulating situation where there's opportunity for connection, and then you can reason with them. Some of these kids will be able to you'll see that they need regulation. They'll be rocking, or they'll be doing some other sort of somatosensory activity that is an effort at self-regulation. And if you get a sense that that's helpful for them, maybe you should begin to introduce predictable regulatory opportunities into that child's day. Or making sure that every 10 minutes there's a 2-minute sensory break where they stand and stretch, or they can walk. And so there's a whole range of regulating and relational interventions that will minimize these disruptive behaviors.
When we talk about responding to children who have experienced trauma, certainly not all kids have, and not every time a child has a behavioral reaction that's trauma related. But all of the things that we would do for a child who had experienced trauma are going to be just as good for kids who haven't. And so, these strategies for addressing trauma, all of those things are going to be good for any child, whether they've experienced trauma or not.